Hi, I'm Jared Thompson. I'm a student physical therapist at the College of St. Mary, and today we're going to be talking a little bit about how a physical therapist evaluates pain. So, when it comes to evaluating a patient's pain, physical therapists typically separate this into two parts. First, the subjective exam and the physical exam. Both give valuable information to get to know the patient a little more and find the root cause of their pain that they're experiencing. Uh, in specific, the subjective interview is where the physical therapist sits down and has a conversation with the patient to ask them questions pertaining to why they're being seen. The subjective exam should come first, as it is typically used to prioritize and guide some of the testing done in the physical exam. The heart of the subjective exam includes questions about patients' beliefs, uh, their history, their medical history, their area of pain, their type of pain, and their behavior of symptoms. Also, this is where physical therapists can screen for red flags that may require um, other healthcare providers to be seen. Physical therapists should use open-ended questions during the subjective exam, such as why do you think you're having pain, or what do you think caused your pain, or even like what have you tried in the past to reduce your pain. To make sure the patient just feels heard and they're able to voice their feelings and beliefs around their pain experience. When communicating to patients, physical therapists should make efforts to help the patient stay positive about their pain. This includes using positive word choices, reassurance, having good posture when talking to them, and avoiding any negative facial expressions. Also, within the subjective exam, this is where physical therapists can gain a better understanding on whether the patient may have an internal or external perspective on treating their pain. For example, patients with an internal perspective means that they may respond better to taking an active role to reduce their pain through stretching and exercise. And for patients with an external perspective, they may respond better to like passive treatments like manual therapy, heat, or ice. I'll go and dive deeper further into um, these once we get to the next video for treatment. But once the physical therapist is done getting the information from the subjective exam, they should have a pretty good idea on how to plan out the test for the physical exam. Like I discussed in the Science of Pain video, there are three categories of pain that can be found within the clues of the subjective history. And this can be central, peripheral, or nociceptive pain. Based on the nature of pain out of these three categories, the physical exam can be guided towards one or the other. For example, if the patient seems to have more nociceptive symptoms, tests that focus on specific body parts will cause symptoms in the affected area for a positive test. For a patient that has peripheral symptoms, tests that specifically look at nerves will cause symptoms in a more generalized area than nociceptive pain. And patients that come in with centralized symptoms, their pain may be unrelated to any particular test or movement, so looking further into other factors within their lifestyle may be more beneficial. To further speak on centralized pain and the examination part, there are low and high-tech examinations. Low-tech looks at larger movements and are less specific. This may be looking at more functional movements like going on stairs or walking. High-tech examinations are more focused on looking at the patient's sensation and mapping in the brain. Some examples of tests in a high-tech exam include laterality, two-point discrimination, and localization. Each of these look at how specific the brain is at accurately understanding different sensations in the body. With a combination of a thorough subjective and physical exam, physical therapists are able to find the root cause of the pain, make sure that the patient is safe and comfortable during the examination, and come up with an individualized plan for treatment to reduce and improve overall function.